I know that recovery from different surgeries can be different and sometimes challenging. I have operated on many of my relatives and friends, and some of them have stayed with me. So I have an appreciation for what happens after surgery. Oftentimes as surgeons, we are in and out, we do surgery, and patient goes to recovery, they go home, and I usually see the patients the next day, and then a week after, 2 weeks after, and so on. But we don't see what happens in between that first day and 1 week visit. But I've had the opportunity of taking care of people after facelift, and they stayed with me the whole entire time, those first 2 weeks. And I know that they go through a lot of emotions. I know that there is a challenging time where they question as to why they did this to themselves. And they can be depressed about it a little bit. But they get over that phase, and once the swelling goes away, they're super happy and they get over it. And I have to say, personally, I can relate to every rhinoplasty patient that I do the surgery on, because I've had 2 nose surgeries. I was born with polyps, and I could not breathe at all through either nostril. So I had surgery when I was 7 years old. And then because I had scarring from that surgery, I had to have another surgery when I was 19 to make me breathe again. And, I've had the packing inside my nose. I've had the cast. I've had bruising all around the eyes. My second surgery was so invasive that I had both eyeballs completely, red, and I had subconjunctival hemorrhage. It took a while for all of that to go away. So having gone through all of that, I'm so cognizant about what I do to my rhinoplasty patients. I know that, the packing coming out is not comfortable. So I use it only when it's necessary. I don't use it in majority of the cases. And when we use it, we use, Vaseline, gauze, when I can use that instead of those big tampon packs, because it's much more comfortable to remove that than the tampon packs. Having been through some of this stuff, I can relate to the patients, and I can relate to you guys, and I know what to do to make it a little bit more comfortable. And if you have any questions about this process, I'm happy to discuss it with you when you come to the office.